The NEER protocol by Dr. Herald. Postoperatively after my shoulder operations, I follow the NEER protocol. In the first 6 weeks, I follow a passive range of motion protocol, which is basically stretching. The idea is to try and not to put too much force on the repair. So I begin with passive external rotation, and this passive external rotation helps the joint fluid move around the joint and helps mobility in the joint, thus reducing the risk of a frozen shoulder. The sling can be removed gently with the help of an assistant or with the other arm to help with the passive external rotation movement. And by bending forward, the arm comes away from the body by gravity, and then a passive pendular type exercise movement can be performed. This is all that's needed for the first 6 weeks. After the 6-week mark, the patient comes out of the sling. At this point, we begin a more rigorous stretching type protocol. Active assisted exercises are generally used, using a stick to help with obtaining motion with the assistance of the other arm, and also by using the other hand itself. As you can see, the use of a broomstick or a stick can help with both external rotation and with forward flexion movements. Thus, some of the strength can be put through the operated arm with the assistance of the other arm. Following this, a phase 3 protocol begins. In this stage, we've moved on to active exercises and begun resistance training. In this situation, we're demonstrating resisted external rotation and resisted external rotation in 90 degrees of shoulder abduction. This helps strengthen the external rotators of the shoulder, in particular infraspinatus, and also to some degree supraspinatus. Internal rotation also helps strengthen subscapularis, and between the subscapularis at the front and the infraspinatus at the back, one can have a balanced shoulder. By doing internal rotation exercises in 90 degrees of abduction, we're also engaging some of the supraspinatus.